My name is Jamie Solis. I am doing an instructional motivational case study for Pueblo Community College. The class is Clinical Teaching Methodologies with Linda Blassie. So the case study goes as follows. This is a first-year dental hygiene student. Her name is Sarah. She's starting to lose interest in the program. So it's been a really difficult semester. Radiology in particular has been her challenging class. And of course, her course grade is starting to drop as a result. So Sarah is a 27-year-old white female who was a dental assistant for 3 years prior to being accepted into the dental hygiene program. So before applying to dental hygiene school, Sarah has completed all the necessary prerequisite classes and a 10-week dental assisting program. So during the clinical session, Sarah's having a hard time taking diagnostic films and relaying relatable oral hygiene instructions to her patients. Due to the challenges, Sarah is questioning whether dental hygiene school was the right professional move for her. So she feels a little bit disconnected from the program and is considering dropping out. Thankfully, Sarah has taken the initiative to speak with the dental hygiene clinical director about how she's feeling. So the clinical director was very happy that Sarah chose to come to her and discuss with her her thoughts and how she's feeling about the program. This was the perfect gateway for the instructor to give the student some encouragement and help to build up her confidence. So the conversation ended with the director letting the student know that she would reach out to the other instructors and she would get back with her very soon on a plan. So the director reaches out to the other instructors. They come up with a game plan to help Sarah get back on track. Understanding that Sarah is an adult learner, some key elements have been taken into account. So first of all, she has firsthand experience within the dental field with her 3 years of dental assisting. And prior to this hardship, she was really motivated to help further her education. So the plan is to help Sarah find her motivation and regain excitement about completing the dental hygiene program. So they plan to have a very informal meeting with the clinical director, the radiology instructor, and Sarah. So mentioned in the conversation with the clinical director, Sarah was having a hard time with taking radiographs. Noted she's fairly shy, so it makes it difficult for her to feel comfortable asking for help and advice. Also, relaying relatable and feeling comfortable going over oral hygiene instructions with her patients has been a challenge. So her learning barriers are confidence and then lack of information. So discussed at the meeting are steps and suggestions from the clinical director and instructor, and they go as follows. Now that the barriers have been identified, the team can work together for developing strategies to help remedy them. The radiology instructor is now aware that the student needs extra help and has printed out a single-page reference sheet that Sarah can reference when she's taking radiographs. So this sheet includes images and tips to improve patient comfort and placement. So the instructor is helping by providing feedback to the student during the clinical session and spending some additional time helping the student place the films. This helps to improve Sarah's motivation as she uses the reference sheet and gets further help from the instructor. So the key is that the instructor is providing feedback, which is turning around to motivate the student. So as stated in Motivating Students in the 21st Century, students prefer a more interactive lesson rather than a lecture. So to avoid singling Sarah out, the teacher has decided to pair the students up for a couple of clinical sessions with hopes that working as a partner can help create some positive discussions among the students and improve everyone's overall results. So one study suggested that using small groups as well as alternating between 10 minutes of lecture and 5 minutes of debriefing during class discussions can help keep the students engaged and motivated during the lesson. So that's in Motivating Students in the 21st Century. Also, with the help of other students that may be struggling, this may also help other students that have been struggling but may have been a little too shy to ask for help. So in addition to pairing the students, the instructor is evaluating her lesson plan and working on the quality of her instructions. So according to Motivating Factors for Adult Learners in Higher Education, quality instruction embodies strong skills which can include effective planning and organization, manifestation of currency of knowledge of content, use of modern technology, and the instructor embracing the personality attributes. So to address the concern of relaying oral hygiene instructions to her patients, it is suggested that Sarah use role play with fellow students or an instructor. So role play is a way of working through a situation, a scenario, or a problem by assuming roles and practicing to what to say and doing it in a safe environment. So to create a safe environment, it is recommended that Sarah work on applying this style of learning outside of her program's assigned hours. First, the instructor meets with Sarah and gives her a brief written dialogue that she can use when going over periodontal etiology. So Sarah is further advised to review and practice on her own, ideally in front of a mirror so she can self-monitor. Next, the instructor assigns extra credit worksheet that Sarah can work on creating her own periodontal etiology. So 1 week later, the student meets up with the instructor at the clinic, and they help. So this will help create the environment for Sarah, and then she gives the oral hygiene instructions and reviews perio etiology as if she was speaking with the patient. Using mindful repetition, Sarah is starting to create a dialogue that she feels comfortable with, and the words are becoming like an acquired behavior. So mindful repetition, according to Wilner, is where you are fully focused on a number of elements within the practice. So using interactive personal classroom instructions, it's proving to help Sarah as she's starting to excel and become motivated with delivering oral hygiene instructions. So now that Sarah has developed the skill of refining her oral hygiene instructions, the instructor is helping her understand the relevance of information and noting that it is important as a practicing dental hygienist that students are educated and they're educating their patients and their oral status. So relevance helps connect learning with reality. So the projected or actual results with the modifications made to Sarah's instructional learning teachings, she is starting to improve her grade in her radiology class, regain confidence, and see the importance of connecting with her patients while delivering oral hygiene instructions. Using effective academic advising practices, the instructors and the director have helped Sarah get back on track and gain momentum to continue with the dental hygiene program. Without good advising, students can become miserable, stressful, and have unsuccessful delay in graduation. So effective academic advising practices help to stir adult learners in the right direction and open the window for opportunities that accumulate into their success. And that's according to Songro. So hence the importance of building a solid and invested staff to help guide the future dental hygienist. And that is the end of my presentation. Thank you very much.